Hello, everyone. Welcome to our Patients and Ethics training module for the month of May. My name is Berancy Nunez. I am the current compliance officer here at Spectrum Health, and today we'll be discussing everything you need to know in regards to patient rights and ethics. So this is an overview of what we will be training on today. We will be starting off with patient rights, medical ethics, patient-physician relationships, and key takeaways. What is informed consent? Informed consent is a process of communication between you and your healthcare provider that often leads to agreement or permission for care, treatment, or services. Every patient has the right to get information and ask questions before procedures and treatments. Informed consent means that the patient must fully understand and agree to treatment. It helps build trust, supports shared decision-making, and protects everyone legally. The importance of informed consent in healthcare is that it empowers patients to participate actively in their care. It promotes transparency and trust between the patients and providers. And once again, it protects the healthcare providers legally and ethically. When it comes to privacy and confidentiality, it is essential for maintaining patients' trust. Privacy laws like HIPAA and state law specific regulations protect patients' data. Here in the state of Pennsylvania, Commonwealth of Pennsylvania, we have 31 PA Code Chapter 146B, which is the Privacy of Consumer Health Information, and obviously the HITECH Act. Confidentiality encourages patients to be honest and seek care confidently. So let's talk about patient rights in each department here at Spectrum Health. So the first one would be the front and desk reception. The ethical principle behind that is the right to privacy and respect. Respect patient privacy and avoid public disclosures. The second would be medical records and health information management. The ethical principle for that would be right to access and confidentiality. We need to ensure HIPAA compliance and monitor access to PHIs. Third, we have the clinical services. The ethical principle is the right to informed consent and quality care. Using plain language and respect treatment refusal. Next, we have billing and finance. Ethical principle behind that would be the right to transparency and freedom from exploitation. We need to be transparent and offer financial support options to our patients. Fifth, we have pharmacy. The ethical principle behind that would be the right to safe and appropriate medication. We need to confirm allergies, explain medications, maintain privacy as well. And continuing the list, for number 6, we have facilities. The ethical principle behind that will be the right to a clean, safe, and respectful environment. We need to provide a clean and private environment for our patients and also be ADA compliant. For human resources, the ethical principle would be ethical staffing and competency. It is HR's responsibility to hire diverse staff, provide ethics and sensitivity training, and monitor burnout and patient interactions. For our IT and data management department, its ethical principle would be digital privacy and security. IT must ensure data with encryption and access controls. And lastly, we have marketing and communications. The ethical principle behind that would be truthful information and respect for autonomy. We must be truthful and obtain consent for stories or images that we may use on our intranet and website. So now let's move over to medical ethics. Here are the 4 principles of medical ethics. For autonomy, we need to respect patients' decisions. Beneficence is to act in the patient's best interest. Non-maleficence is do no harm. And justice, ensure fairness and equity in care. So what is ethical decision-making? Ethical decision-making is when there is a structured approach that is in place to resolve moral problems in patient care. To the right, there are 6 steps in ethical decision-making, which is to identify, gather, consider, assess, act, and reflect. One of the most practical frameworks that is mainly used would be the 4-box method. The first would be medical indications. Its focus is on clinical facts and goals of treatment. So a question that will need to be considered would be, what's clinically needed? The second would be patient preferences. The focus is on the respect for patient autonomy. So one might ask, what does the patient want? The third would be quality of life. It focuses on the impact of illness or interventions on the patient's day-to-day living. So questions to consider would be, will treatment benefit daily living? And the fourth would be contextual features. So it focuses on a broader of social, legal, financial, and institutional factors. So questions to consider would be, are there family dynamics affecting care decisions? Are there legal issues like guardianship or reporting obligations? When it comes to the patient-physician relationship, trust and communication is key. Trust leads to better care and more honest conversations. Some strategies could be honest and follow through, use clear, plain language, listen actively and check for understanding, and use nonverbal cues appropriately. Respecting patient autonomy and preferences. We need to learn what matters to the patient, values, beliefs, cultural background. Present all options fairly and avoid pressuring decisions. Respect cultural norms. Use interpreters if needed. And involve patients in decision making. Document their choices. So overall, here are some key takeaways. Respect patient rights. Always uphold informed consent, privacy, and the right to make autonomous healthcare decisions. Practice core medical ethics. Integrate autonomy, beneficence, non-maleficence, and justice into every aspect of patient care. Use ethical decision-making frameworks. Applies tools like the 4-box method to resolve ethical dilemmas thoughtfully and fairly. Strengthening patient-physician relationships. Build trust through clear communication, respect for patient values, and cultural competence. And lastly, commit to professional integrity. Recognize and manage conflicts of interest transparently to prioritize patient welfare.